Hello everyone, this is Dr. Kishore Alapati. I am a consultant colorectal surgeon located at Apollo Hospitals Jubilee Hills branch in Hyderabad. Today we will briefly talk about what is rectal prolapse. So rectal prolapse is a disease where the entire rectum would protrude out of the anus, and patients would actually see it as a section of the intestine protruding out of the anus. This typically happens after having a bowel movement or a really hard strained bowel movement. This is something we tend to see usually in elderly females who have gone through multiple pregnancies, wherein the ligaments that hold the rectum back in place kind of stretch out too much, and because they're too relaxed, then the rectum doesn't have enough holding power with the structures around it, so it would try to protrude out. The precursor for a rectal prolapse is definitely a constipation. So anybody who is having hard bowel movements and who are straining or pushing on a daily basis to pass the stool out, by increasing their intra-abdominal pressure will also stretch their ligaments and in turn cause prolapse of the rectum. Diagnosis is very simple. Most of the times I would actually ask the patients to sit on a Western style commode and ask them to push, and it usually comes out by itself. And fair number of times when you ask the patients to lie down back and put some gentle pressure, the rectum usually goes back inside spontaneously. Treatment for this rectal prolapse is very important, because if you leave it unaddressed, then the prolapsed rectum sometimes might get obstructed over there, meaning you won't be able to push it back inside, and that is when the blood supply to the rectum can get cut off and cause what we call a gangrene, and that would require an emergency operation and removing that section of the intestine and maybe giving what we call a colostomy bag, because it is being done on an emergency basis. So once we identify a rectal prolapse, we make sure that the patients are properly and thoroughly investigated to identify the cause of the prolapse. We try to address the cause of the prolapse. But the definitive treatment for rectal prolapse is again surgery, wherein most of the times this is done either with laparoscopic technique or robotic technique, wherein we just make 3 or 4 small keyhole size openings and then bring the rectum or bring it all the way back into the abdominal cavity, and then we stitch it to the spine bone, so it acts like a new anchoring point and it would not allow the rectum to protrude itself out. The good old days, before this advanced technology was available, most of the times a rectal prolapse was being fixed by doing a bag, or we call a colostomy bag, to these patients, or not trying to remove the section of the intestine that was causing the trouble. But now, because of the advent of the technology and advent of understanding what actually causes the rectal prolapse, the typical treatment that we do for this is called a rectopexy, which is done either with a laparoscopic technique or robotic technique. So do not be ashamed if you have prolapsing of the rectum. Please consult your physician. Make sure you follow the preventive measures that we advise you to do, and on top of that, this is done as a relatively simpler procedure using the laparoscopic or robotic technique. Get it addressed and get it taken care of. Thank you.